Lisa Golden is a diabetes care and education specialist. She specializes in working with people with disabilities, such as people living with vision impairments. Welcome, Lisa.
Thank you. I'm excited to be here.
And it's a pleasure having you on. So, Lisa, we want to learn a little bit more about why you decided to become a diabetes care and education specialist. What was it within your world that drove you to that?
Well, I've actually been in diabetes as a career since 1995. I was excited. I wanted in the healthcare industry, and my mother had diabetes, so I thought I knew something about it. And then I learned there was so much more to know.
Mm.
But what really made me become a certified diabetes care and education specialist was because just over 12 years ago, I started working with people with disabilities, specifically with people who are blind or deaf-blind. And there was so much more that I wanted to be able to show that I could help them with. And I felt that it was a good specialty. So it was taking all the knowledge that I already had about diabetes and being able to look at things a little bit differently so that I could provide some better solutions for those individuals.
Absolutely love that. It's always interesting to come from a personal, like that's how you got into it, right? Can you help our listeners understand the complications of diabetes? So let's start with diabetic eye disease. That's the big one that we're here to talk about. What is it, and how is it diagnosed?
Well, diabetic eye disease is, often goes unrecognized. So a lot of people with type 2 diabetes, upon diagnosis with type 2, they have some kind of diabetic retinopathy going on. And with type 1, it may take a couple of years, but then that's the importance of annual exams. But basically, it is damage to the retina or any place in the eye. Now, there are several types of diabetic eye diseases. There is diabetic retinopathy, and that is like bleeding in the back of the eye or forming some um, extra blood vessels in order to feed the back of the eye because it's not getting well fed, um, because there's been damage from glucose to that area. I always say that anywhere glucose, anywhere your blood flows, you could have damage from diabetes. And the back of the eye is very sensitive for that. So that's where diabetic retinopathy comes in. The macular edema is the big bleedings. It's when it really bursts and you've got some blood in the back of the eye. But you could also have some cataracts can be an issue for people with diabetes. There's some other things that could happen. And it's really important that you see your eye doctor as recommended by the American Diabetes Association annually and see if something, and worst case scenario, nothing's wrong with the back of your eye, and they can give you a good exam. And I think, anytime you get any labs that are all in the normal range, that's a good thing.
And so, help us understand how it is diagnosed. Like, what should someone do?
A lot of times people will have blurry vision. Sometimes they don't recognize that they have a problem until they go and see their eye doctor because it's easy for us, both with the symptoms of diabetes and with the symptoms of diabetic eye disease, to just think about them as being, well, I'm tired, I'm getting older. Um, you know, I just am expecting to have this kind of blurry vision, or I think my blurry vision is just because my blood sugar is not normal and not really realizing that there's actually some damage to the eye. So it is often a silent thing that happens. And so many people don't realize that there's a problem until they go in for that exam,
So is usually
unfortunately.
going to the eye doctor and getting that exam, especially if you are someone that has
Yes.
diabetes, letting the eye doctor know and have them screen for that.
Yes.
Okay. Okay.
Because by the time it gets to be something that you are really recognizing with signs and symptoms, it's usually has extensive damage having been done. So you don't want to find out because you've actually lost vision. And I do hear in my work a lot of stories of that, that they were out doing something and all of a sudden their vision, they just went blind suddenly. And sometimes they're able to recover from that, and sometimes it can be a permanent condition.
Mm-hmm. So if this is something that is caught ideally early enough, what are some of the treatments used to help people with eye disease, diabetic eye disease?
Well, the most important thing to prevent diabetic eye disease is managing your diabetes. So, when our blood sugars are as normal as possible, then you're going to not have the complications of diabetes, or it's much less likely that you'll have the complications of diabetes. We know that from the Diabetes Control and Complications trial. So, that would be my first point of view is find out how to manage your blood sugars, whether that's going to a diabetes care and education specialist such as I am, or um, just working with your doctor to find what the right treatment is for your diabetes. Now, once you have some eye conditions. Some of the most common things, I mean, cataracts, obviously, cataract surgery, but um, sometimes there's eye drops that can be prescribed, and they don't necessarily improve your vision, but they can keep some things from happening to your eyes. So it's important that even though you're not seeing improved vision from it, that you're taking those so that they can keep off further damage from happening. There's also some laser surgeries where they can go in and actually laser the parts of the eyes that are damaged. Unfortunately, when they laser it, all it does is keep it from continuing to bleed or grow blood vessels in that area. And so, again, it doesn't improve vision. But recently, there's been, recently, in the past decade, there's been a lot of anti VEGF medications. Now, these are actually injections that go directly into the eyeball, and they can improve vision to a certain extent. Maybe not get you back to 20/20, but can really stop and some of that damage that is happening. Most often, when people start on those anti VEGF injections, they may have to have an injection in the damaged eye every 4 to 6 weeks for so long. And then there's still going to be some maintenance injections. It's just maybe that you're able to go 2 or 3 months without having an injection. So you'll want to be careful and not think just because my eyesight is improved, I don't need these injections anymore. You'll need to still follow up according to what the eye doctor is asking of you.
Have you had instances where your patients have ever been able to reverse diabetic retinopathy, at least in the early stages, by reversing their diabetes or controlling their diabetes?
I work primarily with people who are in the blind spectrum or low vision blind spectrum. So sometimes they're not able to get it reversed as much as someone with early intervention. So, just like there's a lot we can do with pre-diabetes, in that if you do those healthy behaviors, then it has more of an effect, and the medications have more of an effect if they can um, diagnose eye disease when it's just mild, then a lot of the treatments can be much more effective. And like I said, managing your blood sugars can have a huge effect on that as well. So, um, you know, it's not hopeless. There a lot that people are able to do, and people are very grateful when they have extreme blindness and they're able to have some residual vision. People often think of blindness as being you can see nothing. It's just the vision that you have is not very functional. And so when you have more functional vision rather than less, people appreciate those improvements, even though it's not 20/20 vision.
Interesting. And so in your work, when you're working with people who have visual impairments like that, is largely brought on, or at least the people that you're talking to is largely brought on by the diabetes, by having it sort of go so far that it leads to that vision impairment.
Yes. So a lot of people assume that people with diabetes get diabetes education, but often they're at their doctor's, their physician's office, and they're just provided a meter and medication and told to
Mm,
use these. And they really don't know how to use them in the moment, because I really believe blood sugar management is best done in the moment. The individual who has diabetes is able to respond to whatever that number happens to be. I mean, you are not your blood sugar number, so it is important that you're able to use that number and know how to use that number to make little changes or make decisions on what's good for you and what's not working for you. Um, so, with what I recommend is, if you have an opportunity, go seek diabetes education so that you can
mm,
have that information. The doctor often only has 10, 15 minutes with you, so they're doing the best they can to point you in the right direction, versus someone like me, who's a diabetes care and education specialist, can spend time with you getting to know your life and what your personal health goals are, and the things that we need to work around, like the kind of job you have or your busy schedule with your family and all of those kind of things. What works medication wise for you, food wise for you, because we all eat a little bit different. We all, have different activities. You may be involved with your kids' activities or church, or there's a lot of things that can keep someone very busy. And even with the best intentions to maintain our health, we may not always have time or the opportunity to do those. So, diabetes care and education specialists can help you figure those kind of things out and
mhm,
work with you for your lifestyle. And I always tell my customers that, please let me know if this isn't going to work for you, because what we need is for you to be able to change your diabetes management over time to prevent either further damage to your eye or getting other complications of diabetes. So if this doesn't work in your life, then I need to know, and we'll talk about other solutions. It may not have been my first choice for you, because I'm going to always offer what I think is the best solution for that moment. But if it's not working in your life, then it's not going to work in the long term.
mhm,
And I also tell people to seek out diabetes education multiple times throughout the time that they have diabetes. You can never remember everything that you heard in one educational session. So it helps to build, and something may pop out and grab your attention, but just life is different when
mhm,
you're in your 20s versus when you're married versus when you have young kids and teenagers and you're an empty nester or you're retired. So life just changes naturally, and at each of those stages we need to find the right way for you to best manage your health.
mhm. And the reason why that is important, so let's say you are someone who gets diagnosed with that, ask your physician, ask your clinicians in your network to connect you to a diabetes care and education specialist to learn about those types of things. And then coming back to the diabetic eye disease real quick, Lisa. So when we're sort of talking about that, what sort of impact does a diabetes care and education specialist like yourself have on the patients that you're working with? Is it about reversal of the condition? Is it managing it? Is it, where do you focus, and how do you empower your patients to make strong choices for themselves?
For most people with diabetes, we're trying to keep them from having an eye condition. So it's preventative care, and by doing that by managing your blood sugar. Once, because I specialize in people with disability, once they come to me, I try to work with them from a point of view of what can they do to best manage their diabetes and therefore their eye conditions, their eye health. Um, how do they manage their diabetes well enough that, when they are having these procedures done, that they're going to get the full benefit? Remembering that all of these procedures, that's stress on the body, and that's stress will raise your blood sugar so quickly. So, how are we going to manage this and deal with that? I also, because of working with disability, try to deal a lot with healthy coping. Now, every diabetes educator will talk to people about their feelings about diabetes, the way that others work with them with their diabetes, not just health professionals, but sometimes the way our family and friends and other social networks, sometimes those situations can be supportive of somebody, and sometimes they can be make it even harder to do those healthy things. So, we always talk about healthy coping, but when you have lost your vision due to diabetes, then you have a right to be angry at your diabetes. So we have to deal a lot with depression, and diabetic distress is a very real condition that people deal with. And so that's something that I work with people about, is what exactly is going on, how do they feel about things, and let's process those so that we can get back to doing. And then once we're doing, ready to get back to doing, then, there are talking blood glucose meters. If you want to be on a continuous glucose meters, there's going to be limitations. So, what are you going to be able to get off of that? And what are you not going to be able to do off of that? How can you take your medications and draw your own medications if you're drawing insulin, or using another type of device in order to give your insulin, or how do you manage your medications? How do you know when to refill? All of those kind of things. So there is some specialty stuff that I do for people who are blind, just trying to see what are they capable of. Sometimes people have a good method of managing, but they just need to fine tune and get back to what they were doing before they lost their vision, and feeling comfortable with doing that. And, it's just a really important thing that you allow the individual who is living with diabetes to manage their own diabetes, even though they have a vision loss. I always let them decide exactly, what they are going to assign to someone else. Like, I understand there's often in most families the person that cooks, and they're going to eat whatever they cook, but they can often say, well, this is how much of whatever kind of meal they're going to have, um, of that I'm going to eat in order to be healthy with my own diabetes. So I can still, even though someone else is cooking for me, I can still maintain control of the portion sizes and all of those kind of things, what nutrients I'm getting.
Lisa, can you talk a little bit about sort of your own journey and how diabetes has influenced that, as well as diabetic retinopathy? And then, really, what advice would you have for someone who's listening here today, around how to navigate both?
Well, my own journey, so again, I came into diabetes as a career about 25 years ago. And knowing that my mother had diabetes, and that diabetes is a family, it's, often genetically passed on, I knew that I wanted to prevent that. So I worked really hard, and considered myself pre-diabetic from, just shortly after I started my career in diabetes. Now, like I said, stress will raise your blood sugar and cause problems. So in 2018 is when I actually got type 2 diabetes. And I'm not going to go through all my personal problems that were happening, but it was multiple deaths. It was a lot going on during 2018 that led to me actually having diabetes. And I do recognize now some of the things that people that I worked with prior to that would tell me about their diabetes or about their eyes. And I very much understand the blurry vision and how it can vary and sometimes be very blurry and very, or not so blurry. Or you have floaters or other kinds of, some customers describe it as like spiders in their eye, like covering up their vision and stuff. And I have had an occasional um, episode of that. And so I have more understanding of what people describe to me. Um, and I just think it is very individual. And I think it's important that we don't dismiss the signs and symptoms that we are receiving because I'm the same way. Even though um, I am a diabetes care and education specialist, when I get a high blood sugar, I've had times where I've gone to sit down and I think I'm going to take a break from work. And so I'll go and sit down, and the next thing I know, my 15 minutes are up and I haven't done anything. And I can't even think of what I thought of. And then suddenly, as I'm getting up to go back and I'm thinking diabetes again, I think, I should go in there and test my blood sugar and see what it is. And sure enough, something will be off. And I was just tired. So, when you're got high or extremely low blood sugars, often the symptom is just that you are tired. You just want to like lay your head there or don't think, and you're not motivated to do things. So some of those are very, um, asymptomatic. And so I love the glucose meter because and any kind of testing, whether you're testing your blood pressure or weighing, any kind of at home testing, and then paying attention to your labs at the doctor's office, because those will tell you whether there's something going on. And you can eliminate if all your lab work's fine, if your blood sugar's fine, if your blood pressure is fine, if your weight is not fluctuating, then you know that it's something else and you can start looking at other reasons. But I've learned to test my own blood sugar as soon as I'm feeling kind of that apathetic, don't not motivated to do what I normally love to do, and then act. And the earlier I act on that, if my blood sugar is just in the 200s and I go ahead and act on that blood sugar, then it's much easier to get it down into the normal range before it gets into the 300s. So early intervention is always the best thing.
Mm-hmm. And so
That's what I would
everyone
encourage
listening up,
people to do.
and so for everyone listening out there, they should really focus on um, communicating to their physicians about getting those checkups done, staying on top of their blood sugars on a day-to-day basis, especially for those people who have diabetes, staying on top of their blood sugars, and then getting all these screenings done. Like have your checklist of all of these different screenings, be it an eye exam, but get all of those knocked out. And if you are someone that has diabetes, find a diabetes care and education specialist that can walk you through all the different things that you're at risk of, including vision impairment.
Yes.
Okay.
And,
All right. This is
I guess one of the things that you asked me that I didn't answer was, I do have mild diabetic retinopathy, not to the point that, I mean, I could claim to be visually impaired. I mean, obviously I wear glasses, but, you know, that's just something that because when I've had my eye exams and we've noticed that I need to monitor and make sure that I'm going in for those annual comprehensive eye exams, which it's an hour to get a comprehensive eye exam, and your eyes are dilated, and it's a lot of stuff going on there. But those are really important to be able to see what's going on.
an hour well worth anyone's time, right? Clearly.
Yes.
Awesome. Well, with that, Lisa, we are unfortunately toward the end of the episode. At this point in the episode, I'd love for our listeners to learn more about how they can connect with you and just stay up to date with your work.
Well, I am available on LinkedIn, and I'm also do a lot of work with the Association of Diabetes Care and Education Specialists. Um, so probably LinkedIn is probably the best way to reach me, or you can reach me at golden.lm@gmail.com.
All right, and we'll note all of that in the show notes for this episode. With that, Lisa, it was such a pleasure having you on. Thank you so much for educating us on this very important topic, on informing us on the importance of this screening, and then more importantly, helping us sort of stay on top of all the different things that diabetes brings and just being more conscious about that. So, thank you again for your time.
Thank you.
And to our listeners out there, thanks for listening to this episode. And we'll continue the conversation on Facebook, on Instagram, and answer this quick question. So, again, find the podcast post on our social media, Facebook and Instagram. Find this podcast episode post there and comment below for this quick question. When was the last time you had your eyes checked? That's right. Be clean, be honest and open on when you got your eye exam done last, and then let us know that you are getting a new exam done pretty quickly if you haven't done one in a while. So we will see you there after the episode. Head over to our social media, Facebook, on Instagram at Yumlish. We will find you there. And again, with that, Lisa, thank you so much.
Take care.